Hello guys, welcome to my channel SwathiPharmaJnan, sharing knowledge. Today's topic is beta-lactamase inhibitors. So we'll see the introduction of beta-lactamase inhibitors. Beta-lactamase inhibitors are a class of antibiotic drugs that blocks the activity of beta-lactamase enzyme, which is responsible for degradation of beta-lactam antibiotics. There is one enzyme which is present in few microorganisms or few bacteria, that is beta-lactamase enzyme. This enzyme will break the beta-lactam ring and it is responsible for degradation of beta-lactam antibiotics and it will affect the beta-lactam antibiotics activity. So that's why when we are giving penicillins or cephalosporins, we can combine with beta-lactamase inhibitors. This beta-lactamase inhibitors, they will prevent the degradation of beta-lactam antibiotics by acting on bacterial microorganisms, and they will block the activity of beta lactamase enzyme. That is how this beta lactamase inhibitors they will work. Examples are clavulanic acid and tinamycin. These two drugs will be combined with the penicillins and cephalosporins when we are giving the therapy for serious or severe microbial infections. First drug is clavulanic acid. We'll see the structure of clavulanic acid. This clavulanic acid contains beta lactam ring. This beta lactam ring is fused with oxazole ring. 5-membered ring with one oxygen and nitrogen, and it is completely saturated is oxazolidine. Consider this nitrogen acts as a common atom for beta lactam ring and oxazole ring. So this is the basic structure. Now to this so this is the central structure which is present in clavulanic acid. Now we will see the substituents what and all present in various positions. Consider this one as the first position. At second position there is a ethyl alcohol is present. CH2OH ethyl alcohol is present. Next at third position there is a carboxylic acid group is present. This is a simple structure of clavulanic acid. You might have seen in the prescription that when the penicillins are being given to the patient, it is combined with clavulanic acid. Sometimes when cephalosporins are giving to the patient also, they will combine with the beta lactamase inhibitors like clavulanic acid. Amoxicillin and clavulanic acid is one of the best combination you can see in the prescription, which is used to treat variety of bacterial infections. It will stop the growth of bacteria so that the further bacterial infection can be arrested. Next structure is tinamycin. In the name itself we have clue that Thi indicates a sulfur atom is present. Na indicates there is a ethyl amine side chain is present which is attached to sulfur. So this is the structure of tinamycin. The basic ring is a beta lactam ring is present. To this beta lactam ring there is a 5-membered ring with one nitrogen which is fused with the beta lactam. Here also the nitrogen acts as a common atom between this ring and this ring. So this is pyrrolin. This is beta lactam ring. Now consider this one as the first position, and at second position there is a thioethyl amine as the side chain, and at third position there is a carboxylic acid, and at this position there is a ketone group which is common in beta lactam ring, and at this position that is sixth position. This is third position, fourth position, fifth and sixth position, and at sixth position ethyl alcohol group is present, CH2CH3OH. It is a naturally produced beta lactamase inhibitor. This one is a naturally produced beta lactamase inhibitor, means we can extract this beta lactamase inhibitor directly from the microorganism. Tinamycin antibiotic is produced from Streptomyces cattleya. It is used to treat various gram-positive bacterial infections and gram-negative bacterial infections. This tinamycin also combined with various beta-lactam antibiotics like penicillins and cephalosporin. We'll see the mechanism of action. We all know that all beta-lactam antibiotics will interfere with the synthesis of bacterial cell wall, that is peptidoglycan. During the process of peptidoglycan residues, cross-linking of the peptidoglycan residues, when the bacterial cell wall synthesis is going on, that time this beta-lactam antibiotics will interfere and they will cause the shrinkage of the bacterial cell and they will cause the lysis of the bacteria. After attachment to penicillin binding proteins on bacteria, this beta lactamase inhibitors, they will inhibit the transpeptidation process by inhibiting the transpeptidase enzyme or beta lactamase enzyme. This enzyme will cross link the peptide chains which are attached to the backbone of the peptidoglycan so that the final bactericidal action can be observed by inactivation or inhibition of autolytic enzyme, that is beta lactamase, in the cell wall. So this beta lactamase enzyme is present in the cell wall of few bacteria that will lead to the lysis of the bacteria. But here some tolerable microorganisms also have been present. So that tolerable microorganisms have defective autolytic enzymes so that lysis does not occur in few cases. So this is about beta lactamase inhibitors. We'll see about monobactams in my next video. Thank you.